afternoon, everyone. My name is Sue Brewster and I'm the Executive Director of Auckland Medical Research Foundation. A very warm welcome to you all to the first of our 3 online lectures, which will provide insights into our first 100 days of special COVID-19 research, and that's funded by our COVID-19 research round. For those of you connecting with us for the first time today, we are a charitable trust that was started in 1955. And we are the largest independent funder of medical research in New Zealand. For those of you who join us as our current supporters, a huge thank you to you for your generous support, for your donations that have enabled over $80 million of funding to be awarded to medical research over the years. Your support also enabled the special fast-tracked COVID-19 Research Fund, and it was launched in response to our research community's need to find answers and solutions to the current pandemic and undoubtedly future ones. Our researchers simply couldn't do what they do without your support, and that's what they do best. They do research. So today, I would like to introduce the first of our online presenters, Professor Merryn Gott. Professor Gott has spent more than 20 years working with our older communities and to ensure their voices are heard and inform the support they need as they age. Merryn will present her COVID-19 research the first 100 days into the impact of social isolation among older people. A very warm welcome to Merryn.
Well, tēnā koutou tātou katoa ko Merryn Gott tēnei. Good afternoon, everybody. It's great to have this opportunity to say a little bit about what we've been up to in our first 100 days of our AMRF funded project, exploring the impact of COVID-19 and lockdown on people over 70 in Aotearoa, New Zealand. And I should start by saying that this is one of the most exciting research projects that I've had the good fortune to be involved with. And I think that's for 2 reasons. I think, firstly, it's become really apparent how badly we need good research and good evidence to inform the policy decisions that have been being made. And I think we've been lucky in New Zealand to see the impact that evidence-based policy making has had upon us. I think also I've never been involved with a project which has had such a positive response from everyone we've talked to about it. So we've already had over 400 people over 70 in New Zealand take part in the study, and we've been really blown away by the extent and the richness of the information that people have been sharing with us. And in that vein, I should say that the photo that you're seeing now was sent to us by one of our participants, sharing their experiences about lockdown. So I might be the person here talking to you today, but I represent a very large and diverse team. I'm very fortunate to work with this great group of people, and we come from very diverse backgrounds, but we're all, I think, united by a focus upon trying to promote the well-being of older people, and particularly to ensure that the voices of people aged 70 and above affect the issues that impact them most. So I'd just like to acknowledge my colleagues, and including our Kaumātua group, who helped us design the study in such a way as to make sure that Maori have been safely involved with the project. And if you are a tweeter, then do follow me on Twitter, and I will make sure that all the slides from today are up on our research blog. And I should say that we are based in the School of Nursing at the University of Auckland. So I'll just start by giving you a bit of background to the project and why we thought it was important. And so we designed the project at about the time when we were just starting to hear more about the virus, and we were in particular hearing that it impacted people over 70 particularly. And what we were really aware of was that there was a lot being said about the impact of coronavirus, as it was then known, upon people over 70, but we were actually hearing very little from people of that age group themselves as to what they felt the messaging was like and what their experience of this was like. And that's when we decided it was really important to do some research that actually got to those experiences. And another thing we were concerned about was that there could potentially be a second wave of harm related to the pandemic, because we'd recently finished some work looking at the impact of loneliness and social isolation across New Zealand. And we were really aware that this was a significant issue for many older New Zealanders, and that this is something that could be exacerbated by the current lockdown situation. So we were really keen to explore this in more detail, particularly as we know that loneliness can have a similar impact upon people as smoking and obesity, and it's actually a very significant public health challenge. So we were really thrilled when AMRF put out the call for projects related to the impact of COVID in New Zealand. And we were also really thrilled that the whole funding stream was turned around so quickly. We could get ethics through really quickly, and we were able to start. So when I looked at what we've actually done in the first 100 days, it's actually been really extensive. And so it's really exciting to have the opportunity to share that with you now. So overall, the aim of our project was to understand the impact of the COVID-19 pandemic upon people over 70 across all cultural groups, and to make sure their experiences informed government, NGO and community public health responses. And so, as I said, it's really exciting for us to be able to inform the evidence that promotes our policy making moving forward, not just for this pandemic and future iterations, but also now we understand our susceptibility to pandemics, to how this might play out in the future. So the project is being done in several phases. So we've got lots of things happening at the same time. In the first part of the project, we are interviewing people who we identified in a previous project as being at risk of being socially isolated and or experiencing loneliness. And we were particularly interested in how the lockdown experience was impacting upon them. And so we're interviewing approximately 30 older people, and they're from different cultural groups. So we're speaking with Maori, Pacific, Chinese and Korean and New Zealand European older people. And we've got a great research team, a team of interviewers from each cultural group leading out the interviews in the participants' preferred language, which is really exciting. So these are some of the things that we are exploring. We wanted to look at what people's concerns were, how people adapted, and also we were really keen to find out what people themselves, older people themselves, have actually been doing within their communities during the period of the pandemic. And I'll share some of the stories that we've learnt with you a bit later, because there have been some really amazing things happening. So I just wanted to share some initial reflections from the interviews. I should say that this is really early days, so we haven't started analysing our data. I think we've done about 2/3 of our interviews so far. So these are just some of the things that are coming out for us at the moment. I mean, the first thing to say, as you might expect, is that experiences have been very diverse. Some people enjoyed the experience of lockdown. Many older people are very busy doing different types of work within their communities. So they actually said, someone wrote me a letter today, in fact, talking about the benefits of enforced idleness and how they enjoyed that. But that's not to say that people didn't experience challenges, and I'll share some of the things people have been talking about. Some people did feel very isolated and very lonely. People talked about neighbours as providing a good support during this time. And as I said, people did talk about the sorts of things they actively were doing themselves to promote their own social connection. So there was a lot of talk about learning to use new technologies and, you know, getting food. So people talked a lot about food, which I know was a challenge for a lot of us, and a concern about whether we could get access to food. And we're hearing a lot about how organisations like Age Concern were helping people to get access to the support they needed, upskilling people to be socially connected and to be able to do things like participate in online food shopping. People talked about health appointments, how strange it was to go to the doctor during this time. And there was some concern shared by people about what was expected of them as a person over 70. There was a feeling that sometimes the messaging wasn't clear around that, particularly when we moved between lockdown levels. And there was also some concern about if people went out and about, how they would be received. you know, be saying to them, you shouldn't be here and you should go home. And we had a little bit of that, but we also heard that people did feel well supported. So we're really looking forward to diving into the data in a bit more detail. And I think we're going to have a very rich account of what that experience has been like across New Zealand for diverse cultural groups. So in the second phase of the research, we've been doing a media analysis. And what we were really interested in is, you know, were our initial impressions about how the media were talking about people over 70 actually borne out by looking into the media reports themselves. So what we did is we looked at a sample of just under 100 written newspaper articles which were published during March, as that was the period that was running up to lockdown, when there was a lot of talk about people over 70 being at risk. And there was a lot of concern, and I'm sure you can remember the anxiety you felt at that time, because we just really didn't know what was going to happen. So what we were looking at was, how have people over 70 been represented in New Zealand news coverage? How are they framed? And also, you know, to what extent are they talking about their own experiences? And we thought this is important because what the media says both reinforces and reflects what we as a society feel. So what we found was that almost all the articles we looked at framed people over 70 as being at risk. And interestingly, 2/3 framed people over 70 as being passive, and only 1/3 framed people over 70 as being active. So there was a lot of othering talk, a lot of, you know, the use of words like they, and they need looking after. And here's an example for you. Check in on them, offer to help, do little things, make sure they're not on their own. So obviously these messages are very well-meaning, and they were around making sure people were safe. But we're certainly hearing from our letters that, you know, some people did find this quite patronising and really felt like, you know, they were lumping everybody's experience into one category, and ignoring the fact actually that lots of older people are very active in their communities. And indeed, one of the things that we heard straight away from our partners in the project at Age Concern was that they were really struggling because a lot of their volunteers are over 70, and therefore that, you know, they were having real problems keeping their services running. And I think this was sort of one of the most telling things to come out of the media analysis, was looking at who's actually speaking for people over 70. And as you can see, the vast majority of the talk in these articles was not by older people themselves. So actually only 19 out of the 91 we looked at quoted someone over 70 talking about their own experiences. And one of the things we want to do moving forward is to develop some media guidelines to support the media in engaging with older people in a way that is appropriate and that actually resonates with them. And I think this is one thing that we really need to get across, is that people over 70 need to be allowed to talk about their own experiences. And our media analysis is going to be published in a special edition of the Journal of the Royal Society of New Zealand, along with quite a few other COVID-19 related research projects that are going on at the moment. So it's really exciting to be a part of that. And so that brings me on to another phase of our project, and this is a really exciting phase, and this is our Have Our Say project. So the idea from this really came from thinking about the sorts of archives of letters that were created during our last big pandemic in New Zealand in the early 20th century, the Spanish flu pandemic. And we became really interested in, you know, how are we recording this event for future generations? And we've been really fortunate to secure partnership with the Auckland War Memorial Museum to create an archive of letters of older New Zealanders. So what this means is that we've invited people around New Zealand over 70 to write us a letter talking about their experience, and they can then opt in to have that letter recorded in the archive for future generations. We were really keen to make the project as accessible as possible, so people can write in any language they want to, and you can take part online, or you can take part postally, or you can give us a ring. And I've got some details if you want to take part, or if you want to encourage others to take part in a few slides' time. But I thought I'd just share with you a little bit about what people are saying to us. the first thing to say is that we've been really overwhelmed by the response. So I think when we first did it, we thought we might get about 100 letters. We currently have over 350, and we're still actively recruiting. And we really hope to get up to 500. So that's our new target. The majority, about a third have come from Auckland, and then Christchurch, Canterbury and Wellington are sort of bringing up the numbers. And we didn't have any from Gisborne when we last looked, but we've got a researcher going down to Gisborne this week. So hopefully we'll have some from the whole country eventually, which is really exciting. About 2/3 of the people who've written to us are women. The majority of people have done the online survey option, but we do get a nice pile of letters on our desk every morning, which is really exciting. And people have also been sharing things like their diary with us. So this is a picture of somebody's diary that they very kindly gifted us and gifted to the archive. And people have also been sending us pictures. And this is one of our favorites. So this is a 75-year-old woman from Auckland, who's a very talented artist. So she painted this picture of Dr. Ashley Bloomfield on a rock because she felt that he was her rock during lockdown. So that's how she wanted to represent him. So people are sending us all these amazing creative things that they got up to during lockdown, all the knitting they were doing, pictures of baking and jigsaw puzzles and all sorts. So it's just been great to kind of challenge the ideas that are coming through within the media analysis that we looked at. So here's an example of someone challenging the media representation of people over 70 as being very passive and being needed to be looked after. So this is Shona, 79, from Tauranga. And I should say we've checked in with everybody around whether they're happy for their quotes to be shared today and how they want to be represented. So she said, I enjoyed the lockdown as a frontline nurse. I was able to work for 1 day a week, which got me out of the house and able to communicate with others. She talked about doing a very thorough cleaning, which I'm sure, well, many of us aspired to do. In my case, I didn't actually get there, but it was certainly an aspiration. And she was very keen to get across the point that people over 70 are not fragile, that, you know, it's coming through that people did really appreciate the way that the safety measures were handled. But I think there's still some concern around feeling a bit patronised and a bit like, as I said, all older people were treated as one big homogenous group. And obviously we can see from this that there were a lot of people over 70 who were very actively contributing towards efforts to contain the impacts of the pandemic. Here are a few more photos that people have sent us. People talked about liking going out and looking at the wildlife. They liked the quietness. Lots of people talked about the teddy bears that we saw popping up everywhere. And it seems like these acted as a really nice way to promote social connection. People feeling like if they couldn't get out and about, at least they could put a teddy bear and have some interaction with people through their window. And this is a picture of a jigsaw puzzle that someone did. And we've got a few sound bites to share with you. So we contacted some of our letter writers and asked if they'd actually speak to their letter so we could share that with you. So I've got one now to share with you.
I'm an 85-year-old widow of European descent living on my own in Auckland. During the COVID-19 lockdown in 2020, I was very fortunate to have my cousin, also a widow, live with me for the entire period of level 4. She returned home at the beginning of level 3. We shared housework, watched Netflix and television in the evenings, read books, and walked most days in the nearby parks. My walks being a lot shorter as I have back and knee problems. I was able to write up a family history of my late husband's family from documents that had been stored in drawers and cupboards for several years, as well as adding to a story about my own life. So all in all, I did not find level 4 too arduous, nor for that matter levels 3 and 2. I was also able to keep in touch with friends over the phone and tutor a young schoolgirl from Taiwan in English via my computer and the phone.
So we heard lots of stories of the sorts of things that people were doing, and in this case, tutoring someone from Taiwan in English, which is quite amazing. Another thing that people told us about was their experiences of previous historical events that this reminded them of, including previous pandemics. And this is a cartoon from the polio pandemic in New Zealand in the 20th century. Has a little bit of resonance, or I think my colleagues with younger children were more worried about their work than their housework. But lots of people did talk about having actually had similar experiences before, which actually they felt made them be more prepared for coping with the current situation than a lot of younger people. So the same lady who was just speaking shared this with us.
When my grandsons happened to say that they missed meeting up with friends, going to the movies, and that schoolwork over the computer was not the same, I reminded them that as a 12-year-old recently arrived from overseas and with only a few weeks of schooling in New Zealand, I had to face the 1947 polio epidemic, when all schools were closed until May of 1948.
However, people did also raise a number of challenges that they experienced, and I think it's particularly coming out as this was significant for people with health conditions or who were caring or supporting for others within their bubble with health conditions. So, for example, Rosalind, age 71 from Waikato, who's a wheelchair user with MS, talked about her anxiety about professional carers coming into the house, about the fact that they did not have adequate PPE and that they were moving between different people's houses, and particularly sick and disabled people's houses, and her concerns that the virus might be spread in this way. And for many, these sorts of concerns were really significant. We also heard about the challenges when respite care was not available. And also some people talked about issues around getting hold of medication, that they weren't able to get hold of medication in a timely way, which had very negative impacts upon their health. So in the next clip I want to share with you, Doreen is going to talk about her experiences of supporting her husband, Jeff, who has vascular dementia. He's taken part in a previous project with us where he talked a lot about this amazing Morris Minor that he restored. But in this clip, Doreen's going to talk a little bit about the impact of lockdown upon them as a couple.
Jeff, who has vascular dementia, found isolation difficult to begin with, especially from level 2 onwards, as his routines were all gone. What day is it? Shouldn't we be going walking today? A blackboard displaying day and date did help answer some of his questions. The teacher coming out of me. During level 1 and 2, I was able to drive Jeff to our beach reserve and sit in the car and sip a hot drink and watch the waves roll in and talk to friends through the car window. It was a little strange to see a police car drive by checking to make sure only those who were allowed to be out and about were obeying the rules. I was able during level 2 to walk Daisy, our dog, up and down our street, keeping our 2-meter distance. We were lucky the sun was shining most days, so this did make you feel good and not too isolated. Jeff derived so much enjoyment from attending his dementia group. No more exercise from walking around the Auckland Botanic Gardens on Tuesday morning with Daisy, our dog, sharing coffee and conversation with group members. We had to hang up our dancing shoes. No more music and movement, and reliving our youth and the time that we met our life partner on the dance floor. I missed the conversations with other carers on Tuesdays, Wednesdays and Fridays. Dementia Auckland helped us by enabling the groups to stay connected through Zoom. This was wonderful as everyone could see and hear each other, even if we couldn't hug. This was a time of conversation, quizzes and sharing our lives.
And the final clip I want to share with you is from one of our Maori participants, Dr. Merryn Gott. And we're working at the moment with our Maori researchers, Dr. Tess Moiki Maxwell and Stella Black, to recruit some more Kaumatua to take part in the Have Our Say letter writing. And I think now that we're able to meet face to face, it's much easier for us to encourage participation. And Tess has done some amazing radio interviews. If you want to learn a bit more about the project from a Maori perspective, they're all on our Te Arai blog. So this is what Mary wanted to say to in her letter.
To whom it may concern, tēnā koe, the Covid-19 lockdown and the tangata whenua. I am getting older. There is still much I love to do. To mow the lawn and keep fit and healthy. To pick garden fresh vegetables, all to enjoy. To clear the forests of pest weeds and feral creatures. To protect the manawa forest on the mudflats along the shore. To write thoughts and words that educe. To have a say in how people rule the tangata whenua.
And then I just wanted to leave you with some words that Mary shared with us, which I think really highlight some of the diversity amongst people over 70 and why it's so important that we hear their voices and that their voices inform our policy making moving forward.
I should remember that ageing is not just a biomedical event, and older people are not a single uniform group. I know 70 plus year old tangata whenua, meaning first people of the land, who are fit and active, and middle-aged relations and friends and younger who are ailing. I have read and discussed the ideas that people experience older age differently, depending on their wealth, health, education, language and culture, gender, sexuality, and their own perception of what constitutes older age. From my perspective, growing older successfully isn't merely a biomedical view of daily living, rather aging well is a fecund experience of the freedom to do good and be happy.
And so just finally, we have some research that we haven't started yet, and that's our provider survey. So we want to talk to providers around New Zealand, such as Age Concern, because we know that they've been doing some amazing work particularly during lockdown and subsequently, and we want to understand a bit more about how that went and what they feel they needed to do the work they did, particularly keeping older people connected and making sure that they could access food supplies and social contact. In terms of impact, we think the project has real implications for policy in terms of how we engage with people over 70 regarding COVID-19, future iterations of this pandemic as well as future pandemics. We think we'll be able to make sure that older people's voices have a real impact and have a real resonance. Obviously, we're working with Age Concern, so the research is directly relevant to the work they're doing every day. And we're really excited about our collaboration with the Auckland Museum in terms of being able to create this archive for future generations. And this is some of the social media that the Auckland Museum have been putting out about the project. That's a great image, I think. And so if you do want to take part, or if you want to encourage others to take part, here are a few ways that you can do that. You can do it online, by email, by mail, or you can just give us a ring to talk to us a little bit more about the project. And this is the letter writing component of the project. And finally, you can keep up to date with the project via our Have Our Say website. Moving forwards, we're going to develop the website to create an online exhibition of the letters and other findings from the project. We're working with a very talented graphic designer, Dr. Tatiana Tavares, so we're really excited to be doing that. And we also have a Te Arai blog where we update regularly about the research that we're doing, any events that we have and any papers that we're writing. So again, you can subscribe to that or just drop me a line. And just to finish with acknowledgements to our amazing participants. We've been really humbled by the information that you've been willing to share with us, so thank you very much. To our Te Arai Kaumatua, who've really helped us improve and strengthen the project for Maori. There's lots of people around the country who've been supporting us by helping with recruitment. Particularly like to acknowledge our funder, the AMRF, particularly for having managed this round so quickly and efficiently. It's been really fantastic. And also our partners in the project, Age Concern New Zealand and the Auckland War Memorial Museum. Thank you for your time. Does anyone have any questions that they'd like to ask? Okay, I think I've got one here. So how did you find people to take part in your research? Well, that's a good question. For the letter writing part of the project, we've been working with organisations such as U3A, who've been very generously hosting us to come and talk about the project and encourage their members to take part. We've been talking with Grey Power. We've been talking with a number of aged care providers as well. I should say one of the things we're really trying to do is to hear the voices of people who live in retirement villages and in rest homes. So we've been working with some of the providers to try and look at ways that we can make sure that their residents can take part. And we're now moving to out into the community now that it's safe to do so. So we're going to go and meet with some Kaumātua groups and other groups as well. So it's kind of a diverse way of recruitment, snowballing, word of mouth. But as I said, we've been really impressed and surprised and pleased by the response that we've had to the project. I think I've got another question here. Oh yeah, is this research going on in other places in the world? Yes, I'm aware of colleagues in Sweden who are doing a similar project. Museums in Sweden have been calling for letters around experiences of lockdown, so it would be really interesting to compare findings there. I know of work going on in Australia looking at social isolation and loneliness under lockdown, and there's similar projects actually in many countries around the world, so again it will be interesting. And finally, I know of a project going on in the UK, which is also doing a media analysis. So I think it's going to be very interesting comparing our experience, given that our experience of COVID-19 has been very different, fortunately, to other countries. So I think comparing our research findings internationally is going to be, a great opportunity to learn more. Thank you very much for your time.
That was the end of a very insightful presentation from Professor Merryn Gott, and I'm hoping that all of you got some insights out of the research, the 100 days of research so far that Professor Gott and her team are conducting. So for me, particularly pertinent from that research was really the importance of people's voices being heard and the relevancy to them, and not other voices speaking on their behalf when it's something that is directly impacting them. So that's really what Professor Gott and her team are after. And as Merryn said, they are still welcoming feedback. So make sure if you are over 70 and you've got something to say, please do write to Merryn and the team. I'm also sure that Ashley will be delighted to hear he's now got a rock with his face on it. He's had t-shirts and he's had handbags. So another little gem to come out of that one. So, but look, on behalf of us at Auckland Medical Research Foundation, I know you'll join me in thanking Professor Gott and her team for the work they're doing, not only now, but everything they've done in the past and everything they will contribute to going forward. So don't forget, we will be back, same time, same place next week. Please join us. We have Dr. Matthew Rosskrug, who will be presenting on his COVID-19 research and the impact of the pandemic on nurse welfare. So until then, thank you very much for joining us and take care, and we will see you back here next week. Bye for now.